and welcome to Hardy Gastro. In today's video, we're going to be talking about a very common and interesting topic, and that is the nail fungus disease. So let's get started. So what is the nail fungus? The nail fungus, which is also commonly known as Onychomycosis or Tinea Unguium, is a fungal infection of the toenails or fingernails. A fungal infection of the nails may cause changes in the nail itself and its appearance, including a white or yellowish nail discoloration, thickening of the nail, and the separation of the nail from the nail bed. Dermatophytes, yeasts, and other non-dermatophytic molds can infect the nails and cause the infection. And it is said that Trichophyton rubrum is the most common type of fungus to infect the nails. Another important point to mention is that toenails are usually more commonly affected than the fingernails. So from this definition of the nail fungus, we get that it's also commonly known as onychomycosis or Tinea Unguium, and is actually the fungal infestation of either the fingernails or the toenails. So there are many different species of fungi that can actually be the cause of the infection, but the most common specific fungus, which is responsible for the majority of infections, is Trichophyton rubrum. And this is actually what the Trichophyton rubrum fungus looks like when it's cultured in a laboratory from samples which are taken from patients' nails. So when this fungal infection occurs, it can either occur in the fingernails or the toenails, but the toenails seem to be more commonly affected. And the infection often leads to quite specific changes in these patients' nails. So the nails actually appear to have a yellowish discoloration, they become much more thicker, as we can see here, and in some cases, there can actually be a complete loss of the nail because we have the separation of the nail from the nail bed. So this occurs when the fungus completely infiltrates this nail and actually infiltrates the nail bed, which causes the release of this nail completely and will cause the nail to fall off. So now that we know what the basics of the nail fungus is, let's take a closer look at how one can contract this disease. So a number of different conditions can increase the risk that fungi infect the nails. Fungus that is caught from moist, wet areas are common causes in healthy people. Communal showers, such as those at the gym or swimming pools, are also common sources. Visiting nail salons that use inadequate sanitation of instruments, such as clippers, filers, and foot tubs, is another way that the infection may be spread. Living with family members who have fungal nails is also another risk factor. And wearing tight-fitting, sweaty shoes associated with repetitive trauma to the toenails occurs in many athletes and actually increases their susceptibility to the fungal nail. People with athlete's foot are also more likely to have fungal nails since the causative fungus may infect the toenails as well. And it is also said that elderly people with suppressed immune systems are also at a high risk. So from this description, we get that the cause of nail fungus is actually quite widespread and diverse, but there's one common trend that exists throughout, and that is the moisture or the wetness which occurs either in the feet or the hands, which is the perfect breeding ground for these fungi to develop. So the majority of the people who are healthy actually get fungal infections just from keeping their fingers or toes very moist and wet all the time. So this can occur if you use covered shoes all the time, or even if your feet are actually squashed up in shoes, which will cause them to sweat in between all these spaces and cause the fungus to thrive within these areas. Also, visiting nail salons in which the instruments may be contaminated can also cause the disease, or even using communal showers or swimming pools, or living with a family member who has the infection. And the other important point, as I mentioned, was that elderly folk with suppressed immune systems are usually at a higher risk of also developing the nail fungus. So now that we know how one can get the nail fungus, let's take a closer look at some signs and symptoms of the disease. So these patients will present with nails that are thickened, as we can see here. They have a whitish to a yellow-brown discoloration, as we can see in these various images. They are brittle, crumbly, or ragged, as we can see. They have a distorted shape. They have a dark color caused by debris building up under the nail. So as we can see, the top of the nail can appear dark sometimes because of debris which builds up at the bottom. And they can also have foul-smelling nails. So these are the various signs and symptoms which these patients can experience. The diagnosis of nail fungus So the doctor will examine the nails, and then he or she may also take some nail clippings or scrape debris from under the nail and send a sample off to a lab to identify the specific type of fungus which causes the infection. So usually when the physical examination is done and we examine the nails closely, we can actually put the clinical diagnosis of a fungal nail infection or a onychomycosis. But if we would like to identify the specific type of fungus which is involved in the infection, we can use some nail clippings, or we can scrape some debris off the affected areas and send them to a lab for further testing so that we can find out the specific fungus responsible for causing the infection. And finally, let's talk about the treatment of the nail fungus. So depending on the type of fungus causing the infection, as well as the extent of the infection, the patient may be required to take some antifungal medications for several months. Topical solutions and creams aren't generally effective in curing the nail fungal infections, therefore oral antifungal medications are usually indicated. These medications include terbinafine, itraconazole, fluconazole, and grisulfulvin. And that brings us to the end of this video on onychomycosis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure to turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.